Assalamualaikum warahmatullahi wabarakatuh. My name is Fadia Septi Octaviani. My ID is 211601021. I am from Bachelor of Nursing, grade 2nd and class A. In today's video, I'm gonna tell you about autoimmune disease. A healthy immune system defends the body against disease and infection. But if the immune system malfunctions, it mistakenly attacks healthy cells, tissues, and organs, called autoimmune disease. These attacks can affect any part of the body, weakening body functions and even turning life-threatening. Scientists know about more than 80 autoimmune diseases. Some are well known, such as type 1 diabetes, multiple sclerosis, lupus, and rheumatoid arthritis, while others are rare and difficult to diagnose. With unusual autoimmune disease, patient may suffer years before getting a proper diagnosis. Most of these diseases have no cure. Some require lifelong treatment to ease symptoms. So, why does the immune system attack the body? Doctors don't know exactly what causes the immune system to misfire. Yet some people are more likely to get an autoimmune disease than others. Some autoimmune diseases are more common in certain ethnic groups. For example, lupus affects more African American and Hispanic people than white people. Certain autoimmune diseases, such as multiple sclerosis and lupus, run in families. Not every family member will necessarily have the same disease, but they inherit a susceptibility to an autoimmune condition. Because the incidence of autoimmune disease is rising, researchers suspect environmental factors like infection and exposure to chemical or solvent might also be involved. Here are autoimmune disease risk factors. Researchers don't know what causes autoimmune disease, but several theories point to an overactive immune system attacking the body after an infection or injury. We do know that certain risk factors increase the chance of developing autoimmune disorder, including genetics. Certain disorders, such as lupus and multiple sclerosis or MS, tend to run in families. Second, weight. Being overweight and obese raises your risk of developing rheumatoid arthritis or psoriatic arthritis. This could be because more weight puts greater stress on the joints or because fat tissue makes substances that encourage inflammation. Smoking. Research has linked smoking to a number of autoimmune diseases, including lupus, rheumatoid arthritis, hyperthyroidism, and MS. Certain medication. Before starting or stopping any medication, however, make sure to talk to your doctor. And here are autoimmune disease symptoms. The early symptoms of many autoimmune diseases are very similar, such as fatigue, achy muscle, swelling and redness, low-grade fever, trouble concentration, numbness and tingling in the hands and feet, hair loss, and the last, skin rashes. Individual diseases can also have their own unique symptoms. For example, type 1 diabetes causes extreme thirst, weight loss, and fatigue. IBD causes belly pain, bloating, and diarrhea. With autoimmune disease like psoriasis or RA, symptoms may come and go. A period of symptoms is called a flare-up. A period when the symptoms go away is called remission. Tests that diagnose autoimmune disease. No single test can diagnose most autoimmune disease. A doctor will use tests, review your symptom, and conduct a physical examination to reach a diagnosis. Doctors often use the antinuclear antibody test or ANA when symptoms suggest an autoimmune disease. A positive test means you may have one of these diseases, but it won't confirm exactly which one you have or if you have one for sure. Other tests look for specific autoantibodies produced in certain autoimmune disease. Your doctor might also do non-specific tests to check for the inflammation this disease produces in the body. So, how are autoimmune disease treated? Treatments cannot cure autoimmune disease, but they can control the overactive immune response and bring down inflammation or at least reduce pain and inflammation. Drugs used to treat this condition include non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen, Motrin, Advil, and naproxen or naproxen. Second, immune-suppressing drugs. Treatments are also available to relieve symptoms like pain, swelling, fatigue, and skin rashes. Eating a well-balanced diet, getting regular exercise may also help you feel better. I think that's all about my presentation about this autoimmune disease. I hope you enjoy my presentation and thank you very much for watching. Wassalamualaikum warahmatullahi wabarakatuh.